instructive testimony, and I yield back, Mr. Chairman.
Thank you. The gentlelady yields back. Chair now recognizes the chair of the full committee, Chair Rodgers, for 5 minutes for an opening statement.
Thank you, Mr. Chairman. Today's hearing on the President's budget for the Department of Health and Human Services comes at a time when we need to return hope and optimism to America again, so people can live fuller, happier, and healthier lives. We need to come together to stop the fentanyl crisis and save lives. We need to rein out-of-control government spending to reverse President Biden's inflation crisis so people can afford health care. We need to help build and support strong communities so people are less lonely, less anxious, and restore a sense of purpose and belonging for our children. There must be accountability from the administration, too, for too many ways that they have made the crises worse, especially the authoritarian COVID-19 policies. Secretary Becerra, the President's budget should reflect the solutions we need to make people's lives better. Unfortunately, that's not what we're seeing. Regarding fentanyl, as Mr. Guthrie said, the President's budget only mentions this twice. It's unacceptable given more people are dying from fentanyl poisoning in America, the #1 killer of 18 to 45-year-olds. This committee has heard from several parents, such as Molly Kane, who emphasize their children are not suffering from a substance use disorder, but that their teenager purchased a pill off of Snapchat or bought cocaine not knowing it was laced with fentanyl and died. Your budget request for increased funding for medication-assisted treatment, while important, doesn't seem like it would have prevented these individuals from dying from fentanyl poisoning. This is perhaps the greatest threat facing our communities. But your budget doesn't reflect all aspects of the terrifying reality of this crisis. Regarding healthcare cost, this committee came together just yesterday in a bipartisan way to explore ways to lower healthcare costs with more price transparency and more competition. This is a top priority for those we serve. Yet your budget says nothing regarding bipartisan efforts to implement and enforce the transparency efforts brought forth during the Trump administration. In addition to lowering cost, this administration needs to take restoring trust in public health agencies more seriously. The buck stops with you. You oversee our public health and preparedness policies under CDC and NIH. As I've said, these agencies need to do the hard work of restoring trust with the American people and comply with our oversight before they ask for more money and more authority. The NIH, in many cases, has failed to be a steward of the American taxpayer dollars or ensure lab safety. It has stonewalled this committee's request for information that we are constitutionally entitled to, and it refuses to completely answer questions about what sort of risky gain-of-function research it may fund or what role the National Science Advisory Board for Biosecurity is playing to keep Americans safe. Similarly, the CDC has created a crisis of confidence, so much so that the CDC Director Walensky has undertaken a full-scale reevaluation and reorganization of the agency. This is because its guidance was used to justify mandates that have more parents now questioning routine vaccination. Its guidance, influenced by teachers' unions, kept schools closed to justify mask mandates on kids. We know these weren't decisions based upon the best science and data. Now our children are paying the price, academically, physically, emotionally. Like NIH, the CDC does not need more authority. It needs robust oversight. Secretary Becerra, let me be clear. We expect better. The American people are eager for a brighter future. We expect a high degree of cooperation from you on policies that will help improve their health and their quality of life. And I hope that you leave today with a greater sense of the urgency that I feel and every member of this committee feels to address these problems. And do it in a bipartisan fashion. We are committed to bringing the Republicans and Democrats together to address fentanyl, together to address the need for public health, trust in our public health agencies like CDC and NIH, and together, as we did yesterday, on price transparency that would really help restore the doctor-patient relationship and bring down the cost of health care. That's our goal. We're committed to doing it together, and we thank you for being here today, and there's more to come. Thank you.
Thank you. The gentlelady yields back. The chair now recognizes the ranking member of the full committee,